missing my friends, my family. It frustrates me. I want them here, but unfortunately they're not here. So it really frustrates me that they've been taken away too early, too soon.
2,511 people died from unregulated drugs in British Columbia in 2023, according to a new report. And the Coroners Service says that's the highest number of suspected drug deaths ever recorded in a year. Between November and December, it says an average of more than 7 people were dying per day, and most of those deaths were happening in Vancouver, Surrey, and the Greater Victoria area. Delilah Gregg with the Vancouver Area Network of Drug Users says she wishes the government would listen to people with lived experience to prevent more deaths.
It really sucks that there's been so many deaths, and for me, I have to keep going. There's so many days I just want the world to stop, but I have to keep going to honor my friends and my family who've all passed.
We need to be innovative and brave and listen to the experts and take a different approach.
It's the government that isn't doing enough, according to Chief Coroner Lisa Lapointe, saying on Wednesday she's frustrated as she makes many of the same recommendations to reduce deaths at her last press conference as Chief Coroner.
The most critical thing we can do is expand access to safer supply while also offering people support, help, avenues to reduce their substance use, to become more healthy, to be able to have other options.
The report says there's no indication that BC's safe supply has contributed to the deaths, and that ranges from addiction medicine to synthetic opioids. And as an example, the report says hydromorphone, called Dillies on the Street, was detected in 3% of unregulated deaths last year. Many have called for the government to expand its prescribed safe supply model so people without substance use disorders can access predictable drugs. But the Premier and the Minister for Mental Health and Addictions has consistently said that's not going to happen.
When it comes to our pharmaceutical alternative program, where we're prescribing pharmaceutical alternatives to the illicit drug supply, that is very much about keeping people alive so that we can connect them to the care that we need. And we've just had a very good study published that really shows the benefit of that, the benefit of having people connected to health care.
The outgoing Chief Coroner has described the government's approach to the 8th year of a public health crisis as a, quote, one-off beds and projects response that has killed over 13,000 people.
The problem with their approach is they're not doing enough for the people, although they say they are, they're not, right? And like I said, they're like killing people off slowly.
In Vancouver, Kier Junos, City News.